Night Balance is a startup that has developed the Sleep Position Trainer, a device to treat positional obstructive sleep apnea, or POSA. Sleep apnea is a pause in breathing during sleep. In half the cases, it happens when you lie on your back and your tongue falls backwards, causing the airway to be blocked. The Sleep Position Trainer, or SPT, is a smart wearable device that monitors a patient when asleep and gently vibrates to remind him or her not to sleep on their back, while preserving the natural sleep. Manufacturers can place a CE mark on a medical device once it has passed a conformity assessment. The SPT is a Class 1 medical device, being therefore a low-risk, non-invasive device. Let's start taking a look at the Opportunity Analysis Canvas. The canvas is divided into 3 parts: think, see, and act entrepreneurially. To create a business, it's very important to have an entrepreneurial mindset, motivation, and behavior. Elaine, the founder of Night Balance, has many of the abilities to be a good entrepreneur, such as self-confidence, ambition, and motivation. The second part of the canvas is about analyzing the industry and competition of our business. Regarding industry condition, human expertise is crucial for Night Balance sector, so they found support on a medical advisor board. About the industry status, there are many barriers to enter in the health case industry, such as the cost or regulatory aspects. The society is becoming older and more obese. 2 macroeconomic changes that predispose to obstructive sleep apnea. Finally, when comparing the SPT to the competition, we can see that the main advantages of Night Balance are that it's comfortable, discreet, and easy to use and maintain. And the canvas ends with the Act entrepreneurial part, which consists on finding the value innovation of the product and identifying the opportunity. In order to distinguish from the competition, the added value of SPT is its comfort. Night Balance addresses a problem with quite high prevalence, positional OSA. The current solutions for the patients were quite difficult to use and mostly uncomfortable, which is the main asset Night Balance has. Moving to the growth stages and critical junctions. Introducing the Night Balance's growth stages. In 2007, starting with a research factor, a problem was identified and a solution was created. The idea was born at Delft. Research took place to assure the product's viability and to identify prospective customers willing to pay for the sleep position trainer. Regarding the critical junctures, to start with the opportunity recognition phase, the first step was to identify potential markets, gain knowledge of thinking commercially, and develop a business plan and industry network. In 2009, the opportunity framing stage began. Night Balance was accepted as a startup at Delft and a co-founder was introduced. For the entrepreneurial commitment, there was a need to gain recognition by proving that SPT is the best solution for people with positional obstructive sleep apnea. In 2010, in the reorganization stage, the first working prototype was made, the first clinical study was published, and SPT got CE marked. For the credibility juncture, there was lack of a well-balanced managing team and a slow market adoption. In 2017, the reorientation stage started with the acquisition of the company by Philips, which helped Night Balance reach international expansion. Finally, the sustainability juncture, where in order to reach sustainability, the company has to conquer the whole targeted market. Night Balance is still unable to get fast into the bigger market. The sustainability stage is yet to come. Now let's talk about the value of our product. The value proposition statement answers why someone should do business with us. For the case of Night Balance, it's the following one. Our SPT and web application helps patients with POSA who want to have a good sleep quality by avoiding sleep on their back and enabling a comfortable rest. We can now translate that information to the value proposition canvas. This canvas is useful to create products that customers want because it helps you visualize, design, and test how you create value for customers. It consists of 2 parts: the value map and the customer profile. For the case of Night Balance, this canvas could help the owners detect what patients with POSA wish for and how the sleep position trainer can ease their pain and create gains. Now we are going to discuss the activity map of Night Balance by analyzing their order winners and the enablers that make them possible. The enablers that make the SPT to be trustworthy are the acquisition of Philips, the research and development department, the medical advisory team, the awards won, and finally, all the data collected with the clinical trials. Regarding the performance of the device, all the team is crucial. Moreover, 2 other enablers have been considered, which are that the device is more comfortable and that the patient is changing the habit of sleeping on their back. 4 enablers make the user convenience key in Night Balance. All of them are improvements in comparison to the previous existing alternatives. Finally, the SPT is included in the basic insurance plan, making it free for patients. The 8 clinical trials published were crucial to achieve this. The first step when identifying the beachhead markets of the company is identifying the target end user. The development of an empathy map helps on the identification of the persona because it provides a deep understanding of the end user. This map consists of 7 elements. Night balance is empathizing with people suffering of POSA that need to sleep on one side to avoid apnea. These people see, hear, and say many things in their surroundings, but what they do is not effective enough for solving their condition. And they still have sleep deprivation. What they would like is a device that provides them with a good night's sleep in order for them to have a normal life. Once the target user is identified with the empathy map, it's easier to choose a correct beachhead market. This market is characterized for being small enough for the proper targeting of the customers but big enough for crossing the chasm. An estimated 25 million people deal with POSA in the EU and US. However, only 20% of them are aware of the fact that they have a disease. Therefore, Night Balance estimated that they could reach 500,000 patients. They started by addressing patients in the Netherlands and in other close EU countries, like Belgium, which created a market of 80,000 patients. So this was their beachhead market. Finally, we are going to talk about Night Balance's business model canvas. Night Balance offers the sleep position trainer and the web application as their value proposition. There are 4 customers involved in their usage. Doctors prescribe the SPT to the patients, who are the end users, and in this process, distributors and health insurance work as key partners, enabling the SPT to reach more patients. So, they are also key channels. Night Balance offers online support to patients. In addition, many are the key partners that believe in the potential of the sleep position trainer. Some of them are also key resources like Yes Delft, who provided initial intellectual and financial support until Night Balance can make money from patients. Finally, the key activities of Night Balance involve clinical research, which is also one of the most costly processes they have to invest in. This canvas has evolved through the years and is now more robust since the acquisition of the company by Philips. In the future, the main challenge will probably be the development of a new version of the sleep position trainer. Thank you for watching. Sleep well.